Hi everyone, my name is Ashley and I'm one of the co-founders of Aplum by Skintress.
I'm Tandy. I'm also one of the co-founders, and we're excited to show you what we've been working on. Our first product is Aplum, a digital health platform that acts as a toolkit for those with chronic skin conditions to enhance their quality of life by providing them with tools that help them better manage the physical, financial, and emotional aspects of care. While on the journey of creating this tool, we've interviewed users and customers for our platform. One of them was Marissa, a 26-year-old who has had eczema all her life, has spent between $600 to $700 last year alone managing her condition, and self-proclaimed that 2014 was the worst year of her life. While Marissa's story is unique to her, the struggles she faced are not uncommon. More than 100 million people have been affected by chronic skin conditions like eczema, acne, or psoriasis. And the costs for caring for these skin conditions are high, and so is the time lost. Patients and caregivers on average wait about a month to see physicians, and the direct healthcare costs, which include medical visits and medication, are over $70 billion. And the costs that we don't always see, the sleepless nights, over-the-counter products, and missed days of work, those are over $10 billion. What makes this even more concerning is that communities of color and rural areas are impacted most by the high cost of care and low access. While about 90% of patients feel that their skin impacts their daily life, the reality is that the bandwidth within dermatology care is limited. Less than 10% of dermatologists practice in rural areas, and non-Hispanic Blacks have lower odds of keeping their appointments. So, we've created Aplum, an accessible digital health platform that addresses high costs, lack of access, and helps to translate the patient voice to the physician language. We provide users with both quantitative and qualitative data so that users can better track their triggers through a machine learning image processing algorithm, all the while monitoring their environment, providing them with education, and incentivizing them to use the app through a rewards program that provides discounts and deals. So, if Marissa had Aplum, before a crisis she would be tracking triggers and skin progress to help anticipate adverse events. If she had a flare-up, both the data and education provided would allow her to communicate confidently with care staff. And after a crisis, our platform would continue providing support to sustain health literacy, reduce financial burden, and monitor the condition. And so Ashley will tell you about where we fit in within our competitive landscape.
Currently, there are very limited integrated or personalized solutions to track and educate people on managing chronic skin conditions that aid communication between patients and providers. The features our toolkit provides promote self-care and healthy skincare practices across multiple dimensions like our trigger tracker and curated educational content for our patients for improved health outcomes. We are tapping into the growing digital and mobile health market. Our target market focuses on chronic skin conditions like eczema or psoriasis that have no cure and need to be constantly monitored and evaluated. Our primary customers will be providers, insurance companies, and other pay-vider systems looking to utilize more telehealth resources to save money and time through improved coordination of care. Our customers can save an average of $75,000 in costs through our platform, which allows them to pre-screen patients and evaluate severity beforehand and improve coordination of care, thereby maximizing time spent in the clinic and cutting appointment wait time by more than 50% for cases deemed severe. Our customers get better negotiable reimbursement rates for remote appointments compared to in-person appointments. And both patients and providers save time and money since patients also end up not having to take transportation and miss work as they normally would for in-person appointments. We'll be using a standard software as a service model with a base implementation fee and per active member fee. We project breaking even 2 to 3 years from our launch and growing our user base to more than 50,000 in the next few years. Our main focus currently is to develop and test our MVP and gain traction to aid us in our effort to raise funding to expand our team. And here is our team. Tandy and I both have masters in translational medicine, which specializes in commercializing health technologies, along with a board-certified dermatologist and a remote developer to help bring our vision to reality. We are currently seeking $750,000 for seed funding to expand our team and further develop our product and business.
We are Skintrust, and we thank you for your time.